Hello everyone, welcome to Pediatrics by Dr. Anand. This is the beautiful Unacademy NEET PG platform. Is my voice audible to everyone? Yes or no? Hello, is my voice coming? Yes, is my biceps looking? Yes, yes, or yes. Please let me know. Then we'll start the class. Today is a very beautiful day because today was my thighs exercise in gym, and also we are going to cover some amazing topic of what you call whole pediatrics rapid revision. And the topic of choice today is top amazing syndromes in pediatrics. Is my voice coming to everyone? Yes or yes, 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 yes. Is my voice coming? Choice today is. Oh, it's my voice is coming to me. Let's start the class. Today is a very beautiful day. Many people wants the link of the class. Let me softly, in a very sophisticated manner, let me just send them all the links because it will be helpful for all of us. You know, many people tell me आपने लिंक नहीं भेजा मेरे को, आपने लिंक नहीं भेजा. मैंने बोला अब भेजता हूँ. ठीक है? Class starting now. Okay. I'm just sending the links to everyone because many of us want to get benefited with this amazing $1,000,000 class, which is nothing but the topic is pediatric amazing syndromes, which is so important, and we all keep forgetting the syndromes. But once you attend Dr. Anand classes, everything is over here and it's over here. मेरी pencil कहाँ है? ये रही. The Unacademy NEET PG platform, one of the best platforms, because in this platform we have something known as plus subscription, basically amazing access to our beautiful classes. I mean, the next coming generation batch is going to be so amazingly benefited with the classes because every topic has been done moti ki tarah. Moti ki tarah matlab very beautifully each topic has been incorporated, and also the educators are nice over here. I have worked with Dr. Cheshta. We had integrated class with dermatology, gynecology, Dr. Puneet, Dr. Cheshta, and Dr. Priyanka Sachdev. Beautiful, amazing people. You can watch me on your any device, like the way you watch Shah Rukh Khan. You can watch me also. It's nice. This is the plus subscription, and one of the best amazing Unacademy learning festival. We have this 15 days, guys. This is one of the best offer on this planet. 15 days NEET PG Unacademy plus subscription only at $299. What? Seriously? Yes, $299. $299 is like, it's like nothing. You know, my gym fees is too much. This is like just $299. It's only valid for few days, as the exam is just not even around the corner, just on the head. So this is one pack which is going to be helpful for everyone, where you get amazing access to my plus classes and some crazy 1000 images of pediatrics and much more. One of the best Unacademy can give us. Beautiful. And of course, this is like a unlock session. You can lock it by using the code Dr Anand, DRANAND. That's the amazing code. Use it, finish your pediatrics, get the rank 1, not even pediatrics, everything, and get the rank 1. For the light-hearted students like me, we have this beautiful amazing pack known as Unacademy Light. One of the lightest pack on this planet, where we get amazing previous year questions, basically system-wise manner, full length syllabus coverage, amazing. All India mock test. Every time there's a mock test, I always tell you to give as many mock tests as possible. It will be really helpful for you. Also in the Unacademy FMG batch, of course, one of the best batches on this beautiful platform. MCQs batch, May 11, we're going to start that, just 26, very few days left for the FMG students. Also, every single video of mine is important for INI-CET, FMG, UCMS, and most importantly, NEET PG also. INI-CET is over. We're going to have a recall question session very soon. This is nice one. UPSC. Many of my friends are preparing for UPSC. That's why I thought of requesting for a UPSC pack. So batch on UPSC CMS revision and previous year question papers for May 23, 2022 with amazing people, Obs, Gynae, Ped, Surgery, amazing faculties. NEET PG, NPL, NEET PG Practice League. It's all about revision, and revision. So basically ENT, PSM, medicine, surgery, all the beautiful subjects with all the amazing educators, and amazingly 10 p.m. every day we have this class test. If you're free, give it. It will be really helpful for you. Also, everyone keep asking me, sir, could you please share the previous year question papers? Go to the Unacademy app, go to the self-study, the practice, the subject. You will beautifully find the previous year question papers. Hello, everyone. Hi, Priya, Ibzaswati, Ekta, Sheikh Osama, and many other amazing people. And also, we have this auto daily practice papers. You'll automatically get a notification for the everyday 5 to 10 MCQs, light MCQs for beautiful people for your conceptual understanding. And also, I told you regarding the UPSC batch, one of the best batches happening nowadays, because UPSC, many people are applying. This is the price, this is the pre-launch price, and the beautiful million dollar code I have already shared with you. MBBS, nowadays I'm taking classes for MBBS students pertaining to next batch. We have this beautiful duration, the price and the pre-launch price. If you are an MBBS student, you will be benefited. That's it. Let's start the class. So I have already told you regarding the plus subscription, iconic, and the light subscription with the amazing duration, prices, and everything important about it. Yes, are you ready? Hello, Dr. Julie Tigri, कैसी हो? मैं ठीक हूँ, आप कैसे हो? सब ठीक है? Yashika, Sheikh Osama, Ekta, beautiful people, amazing. Let's start the class. So, before starting any amazing segment, we always have a motivating quote, and this motivating quote basically it is in Hindi language. The quote says, लोग आलसी नहीं हैं, लोग आलसी नहीं हैं, उनके पास सिर्फ ऐसा लक्ष्य नहीं है जो उन्हें प्रेरित कर सके. So such a beautiful quote. लोग आलसी नहीं हैं, उनके पास सिर्फ ऐसा लक्ष्य नहीं है जो उन्हें प्रेरित कर सके. So we all, no one is lazy on this planet. You must have a vision, you must have a focus and a target. A journey without a vision is useless. A journey without a vision is no journey at all. You must have a vision, you must have a focus, you must have some vision, some focus of life, some vision of life. You know, some people wants to go to Italy, some people wants to have an expensive house, expensive car, could be anything. Okay, so that's a good one. Exactly. So beautiful quote. लोग आलसी नहीं हैं, उनके पास सिर्फ ऐसा लक्ष्य नहीं है जो उन्हें प्रेरित कर सके. What do you think? This quote for you? Do you think you can connect with this quote? So let's have a very beautiful class on this planet. Yes, so the class starts now. So yes, the first, now this class is, the topic of the class is the most important topics of syndromes of pediatrics part 2. In the evening 5:15 p.m. class, we recently covered some beautiful milestones, and I mean the syndromes basically, and Osama and many people gave the wrong answer and they nicely got it. So now let's see if we give the right or the long answer. Let's start beautifully. Hanji, hi Khyati. So identify the syndrome, and could you please tell me, if I show you this picture, could you please tell me what is the syndrome comes to your mind? Anyone? This patient basically, what I can appreciate, anyone? Very beautiful picture is this one, Khyati. Yeah, if I say this is a high arch palate, very beautifully study. Okay, have a very good vibes, beautiful vibes. Okay, positive, relax your mind, chill out, have a coffee, sit and talk to me like you're watching a Netflix movie. Okay, my classes are more than that. So beautiful. This one, ye kya hai? This is the high arch palate. Can I appreciate large ears? Yes or no? Can I appreciate that? Hanji. So yes, the patient have a high arch palate, the patient have a large ear. Okay, and also very importantly, the patient is quite, you can say, intellectual disability. Before it was used to say exactly mental retardation, but now it's known as intellectual disability. Very good. So $1 million answer for this question. Yes, very beautifully told by Dr. Julie, who come once in 6 months to our classes. Dr. Julie, good evening. कहाँ थी कि शादी पे गई थी, शादी करके आई है? Cute, nice, लग रहा है वो तो मुझे. Identify the syndrome. Yes, we all know that the patient will have it's nothing but a fragile X syndrome. Could you please tell me, I am a NEET PG and FMG student, could you please tell me, I have no idea about fragile X syndrome. I understood the patient will have a high arch palate and a large nose and a intellectual disability. Can we have any other point? Can we have any important other point, or that much is more than enough? Can I say that fragile X syndrome is the second most common cause of mental retardation? Is it a preventable cause of mental retardation or a non-preventable cause of mental retardation? What do you think? Pragya, Hemal, Dr. Fly, new people, his ID is Dr. Fly on the sky. Very classy, very nice. Anji, so that's beautifully portrayed. Yes, the patient will have this is the second most common non-preventable cause of mental retardation, which is now known as intellectual disability. And the first most common cause of intellectual disability is Down syndrome. Non-preventable, you can't prevent reversible IQ and all that in Down syndrome. No, a patient of Down syndrome will have a IQ delay, so he will have a IQ delay. That's it. So fragile, so PG entrance question number 1, the most commonest cause of non-preventable cause of mental retardation is the Down syndrome. Second most common is fragile X syndrome. And which is the preventable cause? Priya, Sheikh, AV Sony, Hemal, Pragya, Dr. Fly on the sky, everyone. Yes, the preventable will be congenital hypothyroidism. Remember that. Are you agreeing? Yes or no? Is something going inside your head? नहीं जा रहा? क्यूट, पानी पियो जाएगा, ठीक है, परफेक्ट. एंड ऑल्सो व्हाट एल्स कैन बी थिंक ऑफ? ओके, कैन आई से लार्ज ईयर्स? हाँ जी सर, यू हैव ऑलरेडी टोल्ड. ओके, कैन आई से लार्ज नोज? Do you see large nose in a case of fragile X syndrome? What do you think? Anyway, Dr. Julie, क्या large नहीं है? क्या नहीं होता large? Will you see large testes? Will you see large head? Anyone? Is it common in males or females? All amazing, crazy questions. Yes, the beautiful answer is everything is large. Okay, the patient will. It's a male baby. Can we remember MM? Okay, male baby with mental retardation, which is of course now known as intellectual disability. Large face, large forehead, large jaw, large testes, macrodism, and large ears, large palate. What is not large? No nose. N. Nose is not large. Nose is not large. Yeah, exactly, Priya. Nose is normal. Beautiful answer. Let's go to the next one. Yeah, this is a very good question. Dr. Julie, could you please tell me this answer? This is for the students. Very important that you are revising. Which is the most common congenital heart in fragile X syndrome? गलती से मैं नहीं बताऊंगा. I will not tell. Who will tell? Anyone? Pragya. Pragya, she made a nose. Very cute. Cute nose, Pragya. Which is the most common congenital heart? Anyone? MVP? Okay, let's try. Yes. Who is this beautiful person? Yes, Dr. Ekta, Dr. Sheikh. Beautiful. Amazing. The most common congenital heart in disease in fragile X syndrome is mitral valve prolapse. And I think everyone knows about it. We have done this multiple times. Where else do you see mitral valve prolapse? Everyone knows Marfan syndrome. The most common congenital heart in Marfan is mitral valve prolapse, and the most common congenital heart in fragile X syndrome is mitral valve prolapse. Again, recently, 2 days back on Sunday, basically, yesterday we had covered some crazy questions on inborn errors of metabolism. 200 MCQs we had covered yesterday, 3 sessions we had on Sunday, and I hope you guys had participated in the inborn errors of metabolism. We have covered every single inborn error of metabolism, starting from disorders of glycogen storage, disorders of amino acid, everything we have covered on the inborn errors of metabolism. 200 MCQs we have covered. If you have not seen the classes, it's free right now. Before it gets totally logged, watch them. Yes, next question. Yes. Oh, that's a good question, yeah. Which is the first heart wall affected in rheumatic fever? Such a good integrated connected question. Now there are 3 questions you will answer, okay, and the answer is only one. The most common congenital heart in Marfan is mitral valve prolapse. Most common congenital heart in fragile X is mitral valve prolapse. Which is the first heart wall affected in rheumatic fever? Of course, it is the mitral valve prolapse, right? I hope you all know that, right? Perfect. Next question. Very quickly, could you please tell me what is the mode of inheritance and what is the gene mutation? Beautiful, 2 questions back to back. People who are revising, Dr. Julie, जरा please answer बताइए इस बात का. जूली will be like, नहीं ये तो पढ़ रखा है, आगे पढ़ाओ, ये तो पढ़ रखा है. आंसर बताओ पहले, फिर बताऊंगा पढ़ रखा है कि नहीं पढ़ रखा. हाँ जी, कौन बताएगा? Mode of inheritance, anyone? Dr. Julie, I'm waiting for your answer. Dr. Penaz, beautiful answer. So Pragya says X-linked dominant, Ruhi says X-linked recessive. I am confused. Is it dominant or is it recessive? And what is a gene mutation? We have done so many gene mutation. What is the gene mutation? Anyone? Yes, the beautiful answer is it is X-linked dominant inheritance and FMR. Very important. I know it is a repeat nucleotide triple defect, that we all know that, but the gene mutation is important. It is FMR1. Very good, Dr. Sheikh Osama. Very good. Osama, ये तू अपना Osama है या कोई और Osama Sheikh है ये? It's a little new idea actually. That's what I'm thinking. FMR1 gene mutation. Remember that it is important. Imagine, tell your brains you're reading this for the first and last time, that the gene mutation in a case of fragile X syndrome is FMR1. F for fragile X syndrome, F for FMR1 in fragile X syndrome. Okay, fragile X. Chalo, next question. What is this? If I see this picture, could you please tell me what's the best answer? Exactly. अच्छा, अपना ओसामा है तो ये आईडी दूसरी है क्या ब्रो? शेख ओसामा करके आ रहा है, पहले खाली ओसामा आता था. हाँ जी, व्हाट कैन यू सी? कैन आई राइट ओवर हियर पेस प्लानस? Can I write this? Looks like a pes planus or a flat foot. Can I write that? Is it okay to write this one? Obviously, sir, you're very right. You're always right. So pes planus or a flat foot is a beautiful answer. Very good question. What is this, bro? This is a good one. Exactly. Osama कह रहा है दूसरे वाला सेल फोन चार्ज हो रहा है. Okay, buddy. That sounds good. हाँ जी, Osama, very good. What is this? This is a very important question, bro. Please answer me. Where else do you see this? A very important. जूली कहाँ है? जूली कहाँ है? चार्ली चैपलिन फुट, ओके। डॉक्टर जूली आंसर वेरी क्विकली, कई दिन बाद आई हो, थकावट हो रही है, थक गई, घूम के आई थी, क्यूट, नाइस, एग्जैक्टली। सो कैन आई, एग्जैक्टली कैन आई से हाइपर एक्सटेंडेड जॉइंट्स, ऑफ कोर्स, and remember, okay, hyper extended joints you see in Fragile X syndrome also, you see in Marfan syndrome also, both syndromes you will see hyper extended joints, okay, perfect, in Marfan, even in Ehlers-Danlos also, and here also remember that Fragile X. And everyone knows the first most common cause of mental retardation is Down syndrome, second most commonest cause of mental retardation is Fragile X. They are the non-preventable cause, and the preventable is congenital hypothyroidism, we all know that. Okay, amazing. I have a very quick motivating quote. You don't need a new year to make a change. You don't need a new year to make a change. You only need a Monday. For all those who are having excuses, next Sunday I'll start studying. Okay, my friend, her intern postings getting over, then I will start studying. I just had a breakup. I need a break. I will start studying next week. So all that drama, cut it off. You don't need a new year to make a change. You only need a Monday. Very important. Yes, NEET 2020 question, bang on answer, like this you should answer me in 2 microseconds. Dr. Osama, look at this photo and tell me, Hanji, kya hai ye? This gregarious personality, this kind of a thing, it's amazing. And the NEET PG question was that a child has supravalvular aortic stenosis. So what do you think? क्या लेकर आएंगे आप? इस क्वेश्चन को छोड़ के आएंगे, छोड़ के दिखाओ जरा आके मुझे, एक बार जुर्म कर दो ये वाला। हाँ जी, very true. This is nothing but Williams syndrome. Oh, you all know that. Okay, quickly, can you please tell me what is the inheritance? So this to Oscar also knows that it is looks like the most common congenital heart in Williams syndrome is supravalvular aortic stenosis. Everyone knows that. हाँ जी, okay, let's have the next level of questions. Dr. Julie, could you please answer me what is the inheritance of Williams syndrome and what is the microdeletion? कौन से उसका deletion होता है यार, मेरे को याद नहीं है. And don't give me that line, ऑप्शन दे दो मैं बता दूंगा, ऑप्शन दे दीजिए प्लीज, आई विल टेल, ऑप्शन दूंगा तुमको मैं. Such a beautiful answer, such a beautiful answer, Dr. Osama. Dr. Osama, डॉक्टर साहब कह रहे हैं, Dr. Osama has a very beautiful answer. He says ATP7B gene mutation is there in Williams syndrome. Is this line right or is this line wrong? Osama should get a chocolate or he should get a chappal. Anyone? Any quick answers? Quick review. Very quick review. Very good. Very good. So, Dr. Osama, ठीक है, घुटने पे खारिश कीजिए प्लीज, स्क्रैच योर नी जॉइंट, बिकॉज कई लोग कहते हैं कि घुटने में दिमाग होता है तो खारिश करेंगे तो दिमाग बढ़ता है. सो यस, सो दिस ब्रो ATP7B जीन म्यूटेशन इज देयर इन विल्सन डिजीज, ATP7A जीन म्यूटेशन इज देयर इन मेंके डिजीज. यहाँ पे क्या है? इट इज अ ऑटोसोमल डोमिनेंट इनहेरिटेंस. हम क्या पढ़ रहे हैं? व्हाट आर वी स्टडिंग? वी आर स्टडिंग विलियम्स सिंड्रोम. विलियम्स सिंड्रोम इज ऑटोसोमल डोमिनेंट इनहेरिटेंस एंड द माइक्रो डिलीशन वी हैव ओवर हियर इज 7q. 7q. Okay, very good. What is the gene mutation deletion in Cry-Do chart syndrome? Cry-Do chart very important. High okay, I'll not tell. हाँ जी, डॉक्टर जूली आगे आ जाओ. क्राइडू चैट का नाम सुनो है नाम, ओह अच्छा सुनो है, दैट्स नाइस यार. तो प्लीज टेल मी व्हाट इज द वन हाइलाइटर ऑफ क्राइडू चार्ट and what is the gene deletion? Can we link and study? So 7q gene deletion is there in our Williams syndrome. What about Cry-Do chart? Exactly, Cry-Do chart is 5p gene deletion is here in Cry-Do chart and 7q is there in Williams. Chalo, I'm very happy. Autosomal dominant inheritance, right? Could you please tell me in a case of achondroplasia, what is the gene, what is the inheritance in achondroplasia? Very quick answer, very quick. Yes, we have this new ID, very attractive ID. The ID name is Dr. Fly on the Sky. Dr. Fly on the Sky. Dr. Fly on the Sky. Nice ID. हाँ जी, जल्दी. Yes, exactly. A for achondroplasia, A for autosomal dominant inheritance. What about Treacher-Collins syndrome? यार, I've never heard about it. Could you please tell me Treacher-Collins syndrome has autosomal dominant inheritance or autosomal recessive? Anyone? Very quick answer. और गलत दे के दिखाओ एक बार, मैं बताऊं फिर. हाँ जी, ख्याति, रघु, पांचल, शेख, ओसामा, प्रिया, पिनास, वेरी गुड, हर्षित, so many people today. हाँ जी, क्या आंसर क्या दिया है? Okay, perfect. So Treacher-Collins syndrome also, they were dominating students of Gandhi ji, so autosomal dominant. Achondroplasia also autosomal dominant. One quick question I want to ask over here is अपना ये वाला, what about phenylketonuria? Could you please tell me the very quick gene mutation, like the inheritance in phenylketonuria, in L-captonuria, in galactosemia, in maple syrup urine disease. Yesterday, Sunday class, we have done every single disease in depth and beautifully in detail. Every single word we have covered. So if you have attended, well and good. If not, अब तो अल्लाह ही मालिक है. What? Yes, all the inborn errors of metabolism are autosomal recessive inheritance. For the newcomers, you must know this line. Next question. Beautiful picture. Beautiful picture. Please answer. Please. Hanji. Mahira, Dr. Fly on the sky, Dr. Ekta, Panchal. We have Narmata Devi. Hanji. Mota, Meta. Hanji. What is the picture? If this is the NEET PG question, guys, and FMG is just very few less days left, this is the NEET question. Imagine NEET PG question number 2022 is this one. अच्छा, starry iris मेरे को तो नहीं लग रहा. मेरे को नहीं लग रहा. Starry iris दूसरा होता है, ये starry नहीं है. If I give you one hint, this one, this is the one. Anyone? ये साइकिल की तार, साइकिल की पंजा क्या बोलते हैं तो हिंदी में, ओसामा क्या बोलेंगे इसको? साइकिल की चैन तो यहाँ होती है ना, ये क्या है? मुझे हिंदी तो नहीं पता इसकी. हाँ जी, वेरी गुड. एल्बिनिज्म नहीं. दिस इज नोन एज स्टेलेट आइरिस. वेरी इंपॉर्टेंटली स्टेलेट आइरिस. दिस इज नॉट स्टार बर्स्ट आइरिस, दिस इज स्टेलेट आइरिस. स्टेलेट क्या होता है सर? बाबा जानू, ये होता है, ये दिस इज द साइकिल, दिस इज द टायर, दिस इज नोन एज द हब. these things, no, this one, these are known as stellates बोलते हैं. स्पाइक्स जो होते हैं ना, these are known as stellate. So stellate iris is very important, could be a very important new rare image based question. Stellate iris is seen in Williams syndrome. Remember that, Williams syndrome. Okay, perfect, very good. Anji, what is this? If this question comes, this is another NEET PG question. Quick answer, very quick answer. What is this? अपने आप को बोल रहा हूँ, अपने आप को कह रहा हूँ. चलो, प्रॉब्लम है, नहीं कुछ प्रॉब्लम है आपको. हाँ जी, व्हाट इज दिस? एनीवन? डॉक्टर योगेश, जूली, ओसामा, हर्षित, पांचल, एकता, नर्मता. व्हाट इज दिस? इफ दिस बिकम्स द पीजी क्वेश्चन, क्या लिख के आएंगे आप? मैं तो छोड़ के आऊंगा, मैं तो चक्कर खाए गिर जाऊंगा. क्या लिख के आओगे? ओसामा क्या लिखा है? छोड़ के आएगा? छोड़ के दिखा एक बार. कैन यू सी द आई इज गोइंग ओवर देयर? यस और नो? कैन यू सी दिस आई इज गोइंग समवेयर एल्स? यस और नो? So yes, squint, you can say that, of course. So kind of a heterotropia, misaligned eyes. Okay, we have exotropia and we have esotropia. So okay, in the exotropia the eyes turned outwards, in the esotropia the eyes turned inwards and outwards. Strabismus, very importantly, as finding again of Williams syndrome. And very beautiful picture, like this picture though we have done multiple times. Osama, what is this picture? Very quickly please, could you tell me what is this picture? अगर ये एग्जाम में आ गए तो क्या लिख के आओगे? जादू लिख के आएंगे. जादू. जूली तो लिख के आएगी कोई मिल गया. हाँ, कौन मिल गया, कोई मिल गया, ऐसे लिख के आएंगे. गाना गाएंगे साथ में. अवतार. ओके, साउंड्स नाइस. सो दिस, we all know that for the newcomers, in the German mythology, these are supernatural beings. In the German mythology, these are the supernatural beings known as elves. In a case of Williams syndrome, we see something known as elfin faces. In the German mythology, this creature is worshipped as a supernatural being known as elves or elfin faces. In a case of Williams syndrome, that boy looks somewhere like this fellow, like cute big ears and very important like this face. So nothing but I'll show you one picture. This one. So please remember, bro, this one. Tell your number one, tell your brains you have the best memory on this planet. Tell your brains you have a mind-blowing photographic memory. After telling your brains, see, number one, you have to accept and tell your brains. Your brain will say, acha, I have a photographic memory. Okay, that's awesome. So, and then click this photo inside your mind. This picture, very important, and this picture. This face, remember, okay, this face, okay. What is this? Elfin faces. Remember? हो गया याद हो गया. Put a thumbs up to the video. Did you understand? अभी भी समझ में नहीं आया, पता नहीं क्या हो रहा है. देन 16 सोमवार के व्रत रखो, थर्सडे को साईं बाबा की पूजा करो. देन ईट आलमंड्स, 1 चम्मच हनी विद च्यवनप्राश. दैट विल बी द आंसर. This is one Julie was telling. This is very importantly, as everyone knows, this beautiful picture of star burst. सूरज कह रहा हूँ. सूरज नहीं, चांद. Suraj is sun, Chand is moon, Sitara, bro, Sitara, star burst iris. The patient is like this iris finding is basically star burst iris. एग्जैक्टली एंड नहीं समझ में आया, लगा था शक्ल देख के तुम्हारी लगा था मुझे कि तुम्हें समझ में नहीं आएगा. क्यूट. Okay, the patient will have a broad smile. The patient will have a gregarious personality. Gregarious का मतलब क्या होता है? Outgoing personality. Outgoing. Okay, we are outgoing people. Cute. This is a beautiful picture. This baby is so cute. I love babies. I am so blessed by God that I love pediatrics, and it's one of the best branches. Okay, so this one also very importantly, star burst iris, Williams syndrome, blue starry iris, Williams syndrome. Yes, ABCD. Very quick answer. This was the recent Nelson super specialty exam question. Tomorrow also in my hospital we have DNB exam. Tough questions. OSCE will come. I will ask questions to you. Okay, OSCE wale question I will ask you. Very nice. अच्छा उसमें पता है, should I ask you one question today? They were asking it. Okay, who will tell? Okay, leave this question. I have one more question to ask you. Very nice question. If I okay, torch कहाँ है? Torch उधर रखी है. Okay, if I put a torch to my one eye, this pupil contracts. But if I put a torch to my this eye, this pupil dilates. Tell me my diagnosis. What do you think? If I put a torch flashlight over here, mobile कहाँ है? ये रहा. Mobile. Okay, दिख रही है torch. हाँ. So if I put a torch like this, no, like this, like if I put a torch like this pupil will contract. And if I put a torch like that, then this pupil will dilate. आज का question था ये, मतलब in the what you called sample questions थे. क्या? What is the answer for this one? What is the answer for this one? Yes or no? हाँ जी, क्या आंसर है इसका? Afferent pathway defect of the right eye. Okay. Julie says ARP. Okay. Is it Marcus Gunn pupil? Is it Argel Robertson pupil? What is it? This is your homework, okay? Tonight, anyhow, we have a 11 p.m. class. I will ask you another questions of OSCE, okay? मतलब ये DNB exams are very amazing. They are beautifully clinical based question. Very, very clinical, very classic clinical questions. So one pupil, if I put a torch, dilates. And if I put a torch here, one pupil constrict. This constrict, this dilates. So what is this thing? What is this thing? What is this thing? क्या है ये? कुछ नहीं है, ये तो भगवान की माया है. भगवान की माया है. बस फिर माया ही आंसर करेगी उसके बाद तो. This is the what you called yeah. Which one is this? Is this Argel Robertson pupil? Is it Marcus Gunn pupil? This is the homework. Tonight, 11 p.m. I will tell you the answer. So what percentage of children with this disorder, the gregarious personality Williams syndrome, will have hypercalcemia? किसी ने गलती से सही आंसर दिया है ABCD. Yes, the answer is beautifully C. There are 30% chances. There are 30% chances the patient will have hypercalcemia. And very simple, very quick question basically, in which syndrome or in which condition you see hypocalcemia? Anyone? Hypocalcemia कहाँ मिलता है? हाथ खड़ा करिए प्लीज, बताइए. नहीं पता. बहुत अच्छी बात है, नहीं पता. और मत पढ़ो फिर और मुंह बना के पढ़ो. फिर बाद में बोलोगे पढ़ा था, पता नहीं भूल गए, पढ़ा था, आई रेड इट, आई फॉरगॉट. मुंह बना के पढ़ोगे, मुंह बनाए हुए नंबर आएंगे. खुश रह के पढ़ेंगे तो अच्छे नंबर आएंगे. हाँ जी, एग्जैक्ट. डॉक्टर एकता वेरी गुड, नर्मता वेरी गुड, और किसने बताया? आरपी वेरी गुड. इन अ केस ऑफ डाई जॉर्ज सिंड्रोम, वेयर यू हैव एट्रियल सेप्टल डिफेक्ट, डाई जॉर्ज सिंड्रोम, और व्हाट एल्स, कैच 22, हाइपोकैल्सीमिया, थाइमिक हाइपोप्लेसिया, like this you should know, like this. So yeah, so you will have hypocalcemia in a case of Dye-George syndrome and hypercalcemia in Williams syndrome, and 30% people will have hypercalcemia. Next question, please. Okay, cute. What is this picture? Very quick diagnosis. Anyone? क्या है ये? जल्दी बताओ. What is this? Dr. Harshit, Dr. Fly on the sky, Pragya, Julie, Osama. क्या है? One more picture you want? Very classy picture. Please answer. मैं नहीं बताऊंगा. जो करना है कर लो. हाँ जी, what is this? Aplasia cutis. Okay, I can say it is a congenital absence of skin. Can I say this line? This is a congenital absence of the superficial skin, basically. Very importantly, this one, okay, congenital absence of the skin, right? So this is a very classical picture. Very importantly, you can say that this is nothing but one syndrome, nothing but Bart syndrome. Congenital absence, congenital localized absence of the skin, basically seen in Bart syndrome. It's important, remember that, okay? Yeah, very good. This also same only, congenital absence of the skin in a case of Barth syndrome, remember that. This also, this is Williams syndrome, we have done that. Okay, done, over. Okay, this is easy. Okay, chalo, good question. Peripheral pulmonary stenosis may be seen in all except. A good question. Anji, ABCD, very quick. These are little tough questions. Okay, so don't mind if anyone not able to answer. These are little tongue twisting questions. ठीक है, लगते easy हैं. Dr. Julie, इसका आंसर क्या है? Anji, RP, what is the answer? Peripheral pulmonary stenosis may be seen in all except in which condition you will not see peripheral pulmonary stenosis. Anyone? Anyone? Okay, Osama कह रहा है A. Okay. Julie कहाँ है? Julie आंसर क्या है इसका? डॉक्टर एकता एलिगिली सिंड्रोम. अर्जुन okay, the one, Dr. Ekta, you were saying Alligili syndrome. Dear, the most common congenital heart in Alligili syndrome is pulmonary stenosis. Actually, remember, the most common congenital heart in Noonan syndrome is pulmonary stenosis. The most common congenital heart in Alligili syndrome is also pulmonary stenosis. वो तो है ही है, वो तो है ही है. The question is peripheral pulmonary stenosis may be seen in all except in which condition you will not see. The answer is CMV, congenital rubella infection. Okay, in CMV, cytomegalovirus, SCMV. Okay, congenital rubella. The most common congenital heart is PD. Everyone knows. The most common congenital heart in Alligili is pulmonary stenosis, and the most common congenital heart is Williams syndrome is supravalvular aortic stenosis. Right. But pulmonary stenosis can be seen in these three conditions, whereas in CMV, you will not see what you called, okay, you will not see kya, pulmonary stenosis. Acha, okay, RP, very good. Priya, very bad. Okay, Manju, very bad. Hemal, bad. Fly, bad. Everyone, bad. Exactly. Okay, Pragya says, what is the management of congenital absence of skin? What's the cause? Cause is genetic, dear, basically some gene defects, and the treatment, we refer the patient to pediatric, skin specialist, basically dermatologist, for any new skin growth over there or any kind of, skin, what you call it, transplantation. But that's what we refer the patient to dermatologist and symptomatic management. That's it. Usse aage we don't know because we have not treated, because being a pediatrician, this is a skin problem, directly goes to the dermatologist or genetic testing. Basically, it's a congenital problem and all that. Okay, and done. Alligili syndrome, everyone knows about Alligili. I hope you know that. Yes, very classy syndrome. This is the only picture available on everywhere for this syndrome. I think everyone knows about it. So this is nothing but, very importantly, हाँ जी कौन बताएगा? Dr. Fly on the Sky, Ekta, Julie, Hemal, Manuj, नहीं, Moj Rosanna. Yes, George. It's a George syndrome. Can we quickly remember the catch-22 mnemonic? थोड़ा सा याद है किसी को गलती से? ओसामा कहाँ है? समीर, आंसर करो क्या है? अच्छा, मैं बताता हूँ कुछ. एक मैं बताता हूँ, एक आप बताओ, ठीक है? सी से वेरी इजी, हाइपोकैल्सीमिया, फिनिश. ठीक है, व्हाट योर टर्न. एनीवन वांट्स टू पुट एनीवन कोई एक गलती से बताओ. यस, सी फॉर कार्डियक आउटफ्लो tract obstruction. Okay, right. Yes, T for thymic hypoplasia. That's true. Okay, what else? C रह गई. ये A क्या है? H क्या है? Hypocalcemia तो हो गया. Yes, so C for cardiac abnormality, A for abnormal faces, T for thymic aplasia, C for cleft palate, cardiac outflow tract defect, and H for hypocalcemia because the maldevelopment of parathyroid gland. Hypoparathyroidism will lead to hypocalcemia. No, parathyroid gland secretes calcium. So hypoparathyroidism means hypocalcemia. So that's what. And last 22q11 gene mutation. These are all exam question. Thymic aplasia is the exam question. Do you see hypocalcemia in Diegeorge is an exam question? Which deletion is there? 22q11 is an exam question. Perfect. Next question. So is everyone understanding this much? Please put a like button to this video or put a like button in the comment. इतना समझ में आया या नहीं आया? पहले तो ये बताओ, उसके बाद कहानी करेंगे आगे. सचिन सिंगल, हेलो सर फ्रॉम हिंदू राव. सचिन कौन से वाले सचिन हो? कौन से वाला? मैंने पहचाना नहीं. You are there in turn on my batch. Any idea? चलो, sounds good. Thumbs up, thumbs up. Okay, let's continue with some crazy, amazing questions. And tonight, guys, we have another class at 11 p.m. Some beautiful class we're going to have tonight of the important images in pediatrics. These were the important syndromes in pediatrics. We have a class on important images also. You must attend. Hanji, chalo. Uh, let's have a quick motivating quote. So yes, miracles start to happen. Miracles start to happen when you give as much energy to your dreams as you do to your fears. Very smart quote. Miracles start to happen. Can we have some 10 seconds for this quote? Because motivation will give you another vision of life and you will excel like 10x, 10x, not 1x, not 2x, 10x. Two things are important in life: smart work and motivation. You need to have, see, I'm frankly telling you, number one, smart work. Write somewhere, write in your notebook. ये नीट पीजी से ज़्यादा important है. So number one, smart work is important. Hard work versus smart work, which one will you choose? Definitely nowadays I must choose smart work because there is so much to remember. There is so much to remember. You must have a smart work. Number one. Number two, definitely you must have a vision. I had a vision to buy a BMW, and I'm the youngest in my family, in my whole generation, I guess, who has got such an expensive car with my own will and wish and my own dream. So I'm very happy for that and very proud also. So I had a vision, so I had it right. So number one, smart work, and number two is vision plays a very important role in your life. Okay, remember that. So miracles start to happen when you give as much energy to your dreams as you do to your fears. I don't think so I can do it. I think it's very tough. After 6 months, I'll try again. Okay. My friend, she took 3 attempts to clear this exam. एक attempt में किसका होता है यार? किसी का नहीं होता. One attempt तो no one can carry यार. 2-3 attempts are minimum required. No, I have seen my juniors, I have seen my interns clearing rank, very good rank, very good rank. So you also can do it, right? Next question. Oh, crazy questions, crazy questions. Oscar चिल्ला रहे. Oscar. Anji, can we have a very quick answer for this one? Russell Silver syndrome. This is little tough, guys. Try to answer. Try to answer. That's all I can say. It's important. I have tried my best to put it very simple. Anji, please answer. Russell Silver syndrome is associated with which of the following? Very quick question. Can we have a very quick answer for this? कल डीएनबी का एग्जाम है, वो ऑस्की क्वेश्चंस ना कुछ अच्छे वाले होंगे तो बताऊंगा. मेरे मोबाइल का चार्जर कहाँ है? एक सेकंड. हाँ जी, व्हाट्स द आंसर फॉर दिस वन? पड़ोसी आए क्या लगता है. हाँ जी, रशल सिल्वर सिंड्रोम इज एसोसिएटेड विद व्हाट? ए, बी, सी, डी और ई. ई है ऑप्शन? नहीं है तो बना दो फिर. ठीक है, एक सेकंड मैं चार्ज लगा दूं. Okay, okay, okay. Quick answer, quick answer. हाँ जी, someone says C, someone says D. What is this? मजाक चल रहा है यहाँ पे. हाँ जी, someone says Russell Silver syndrome is associated with which of the following? Autosomal inheritance, X-linked inheritance, sporadic gene mutation, and uniparental disomy. Yes. So the best answer for this question is very importantly. E. Dr. Yogi says E. Yeah, thumbs up. I also would have done E only. No problem. Okay. So yes. So very importantly, the answer for this question will be uniparental disomy. Very important session. Very important point actually. जो लोगों ने गलत आंसर दिया है, पहले तो ऐसे करो. अरे गलत आंसर हो गया. And उसके बाद please put in your notes. This is very important, the case of uniparental disomy. And can we have please some good examples of uniparental disomy? Very important. So basically in uniparental disomy, this is the first thing we are studying, Russell Silver syndrome. The class is, what is the class topic? Top important syndromes in pediatrics, right? Russell Silver. The best answer for this question is uniparental disomy. So we're gonna talk about it. So the topic of choice is Russell Silver syndrome. By looking at this picture, can you please tell me? Hanji, very good. So there are various examples of uniparental disomy, like Prader-Willi syndrome, like Angelman syndrome. ये तो सबको पता है, right? I hope you guys know that, and we're gonna cover that. This one is Russell Silver. By looking at this picture, could you please tell me what are the findings? मेरे बोलने से पहले. Do you wanna try? Yes or no? और खाली रटना है बैठ के. Please tell me what is this. Okay, okay, very cute. Someone says double XL shirt. Okay, cute. So do you guys agree with this? Yes or no? Is this a double XL shirt? Is that the finding you could notice? Very cute. May God give you everything in life with lot of best wishes. Okay, double XL shirt के अलावा कुछ और बता दो. Exactly, cute. Number one, it's a male baby. Number 2 with macrocephaly. Please quickly, can we have this one? Yes. So it's a male baby, Russell Silver. Okay. Let's have a mnemonic. Let's quickly have a smart study. MM. Okay. Male baby with macrocephaly. With, can I write? This is a beautiful picture, bro. Can I write limb length asymmetry? Yes or no? लग नहीं रहा कि कुछ ये वाला ज़्यादा बड़ा है than this. The arm span is bigger than the height. Can I say that? It's a beautiful point, bro. Yes, exactly. So it's a male baby with macrocephaly, with the limb length asymmetry. And also the patient will have prominent forehead, triangular face, and small jaw with a narrow chin. Very beautiful point. Please, मेरा पेन गिर गया. So क्या बोलते हैं? हाँ, yeah. So what are we studying? Russell Silver syndrome. Male it was with macrocephaly. You tell your brains you're reading this for the first and last time in your life. That's it. So what are the points of Russell Silver syndrome? Number 1, uniparental disomy. वो क्या होता है? What is uniparental disomy? I'll tell you. First, tell the points. Number 1, it's a क्या था पढ़ा हमने? Male baby with macrocephaly, with the limb length asymmetry, with very important point. Oh, time है? हाँ है. है नहीं इसमें देखो एक बार इसमें है इस वाले में. So yes, very importantly. So yeah, so prominent forehead, then we have a triangular face, and then we have small jaw with narrow chin. And ये क्या है? What is this? What is this finding? सब कुछ मैं ही पढ़ाऊंगा. हाँ जी. What is this finding? Anyone? प्रज्ञा. What is this? क्या है ये? क्या? Cute baby hand. Thank you. I know this. What's the finding? What is this? I will not tell. Anyone? We have YY. ID is YY. Cute. What is this? I will not tell. I'm telling you. What is this? Anji, Pragya, Kanishka. Cute. Nine new people are there. Raghu, Hemal, Ekta, Dr. Fly, RP, Sambhav, Avasthi. Nice name. Sambhav. Nice name, bro. Sambhav is a good name. ये क्या है? क्या है ये? Anyone? Short? Yes. क्या बोलते हैं इसको? कुछ नाम है इसका जिंदगी में. हाँ, RP is right. Can I write clinodactyly? Yes, very good, na? So beautiful you're answering. Everything I'll only answer. Try to answer. Why? Because mistakes are a proof that you are trying to get a rank 1. You're trying. So answer. Okay? So it's a clinodactyly. Perfect. Next point. Very importantly, blue sclera. Of course, everyone knows that. Other than apna Russell Silver syndrome, where else will you see blue sclera? I think everyone knows about it. Can I write osteogenesis imperfecta? Obviously, yes. Okay, perfect. Next important point: the patient will have a very important defect in the chromosome 7 and 11 in 50% of cases. Russell Silver syndrome is little new syndrome for all of us. Please revise and revise. Okay, it's a male baby with macrocephaly, with limb length asymmetry, with a prominent forehead and a triangular face, with little small jaw and a narrow chin. Small jaw and narrow chin. The patient will have a blue sclera with defect in chromosome number 7 and 11 in 50% of cases. Of course, the patient will have, ये तो दिख रहा है ना bro? दिख रहा है dear, clinical knowledge bro. So clinodactyly, of course. So listen very carefully. The patient, क्या बोलते हैं? What are we studying? Russell Silver. It's an example of uniparental disomy. What is the meaning of that? Uniparental. Can I say that uniparental means from the same parent? है ना? इसका मतलब तो मुझे यही feel हो रहा है. Uniparental. So please read this line with me. It's very simple line. Uniparental disomy refers to the situation in which two copies of a chromosome comes from the same parent. है ना? Do you know that? Yes or no? Two copies of the chromosome comes from the same parent instead of one copy from the father and one copy from the mother. Normally, one copy comes from the father and one copy comes from the mother. But in a case of naturally uniparental same parent disomy, the two copies of the chromosome comes from the same parent. Right? I hope this much has gone inside your brains. The various example, very strong, very good picture, very good picture. We have maternal uniparental disomy and we have paternal uniparental disomy. Everyone knows, about the Prader-Willi syndrome and Angelman syndrome. Take a screenshot of this one. Now the YouTube also have stopped, you know that, right? Now you can't take what you call screen videos and screen sharing and pictures on YouTube. This also has been gone. It's all black will come. So you only have to write this one. So this is $1 million picture where I can appreciate that we have uniparental disomy. Every student knows it is Prader-Willi syndrome and Angelman syndrome involving chromosome number 15. But now everyone must know that chromosome number 7, basically we have the maternal uniparental disomy. The example is Silver-Russell or Russell-Silver syndrome, obviously. Have you heard of Beckwith-Weidman syndrome? In this planet, in your life, have you ever heard this name? I hope you must have heard, right? Macroglosia with microcephaly, with hemihypertrophy of limbs, with the kya tha? These babies can have umbilical hernia, slash omphalocele, slash Wilms tumor, और क्या था? Gigantism, okay, large for gestational age, okay. So okay and okay. ठीक है. Now very importantly, I want you to remember, very important, we have chromosome number 20 and chromosome number 14 also involved. The chromosome number 20 for paternal uniparental disomy, the examples are pseudo hypoparathyroidism. Very importantly, for the chromosome 20 which is involved and paternal uniparental disomy, the example is pseudo hypoparathyroidism. Whereas in chromosomal 20 for maternal, this one we have Mool-Chandani-Bhoj-Conlin syndrome. So Mool-Chandani-Bhoj-Conlin syndrome is the syndrome where you see maternal uniparental disomy. See, in the NEET PG, Prader-Willi questions have already come. Angelman syndrome already come. Beckwith-Weidman already 1,000 times come. Russell-Silver or Silver-Russell syndrome also already come. So the syndrome which are left are Mool-Chandani-Bhoj-Conlin syndrome, which is maternal UPD, pseudo-hypoparathyroidism, paternal UPD, and very importantly Temple syndrome also we have, which is again maternal UPD, and Kagami-Ogata syndrome basically for the paternal UPD. If the examiner is very angry with you, if the examiner is like, I will make one question which is not seen on this planet, then definitely he will ask you about Mool-Chandani-Bhoj-Conlin syndrome or Kagami-Ogata syndrome. Okay? How are the names? These names are cute. Do you find them cute? Please let me know. Or they are scary. Yes. Yeah. प्रज्ञा ये सब याद रखना पड़ेगा. थोड़ा सा तो याद करना पड़ेगा, bro. Beckwith-Weidman, you know, right? Russell-Silver, I told you. Prader-Willi, you know. Angelman, you know. Just Mool-Chandani-Bhoj-Conlin syndrome for the mother and Kagami-Ogata syndrome for the father. Just remember that. Next question. So the beautiful answer for this question is uniparental disomy. Coming to, of course, what is this? This is the very beautiful picture. I think everyone knows. Which man syndrome? Kya hai? Which is this? Is it Prader-Willi syndrome or is it Angelman syndrome? So angel, right? Happy angel, right? They're the happy faces. Everyone knows about it. Hanji, Dr. Fly on the Sky. What is your name, Dr. Fly on the Sky? You are the new ID. Okay, yes, exactly. Osama कह रहा है सर कितने syndrome हैं, कैसे याद होगा इतना? Revise. You'll get it. आसान है. Tell your brains. Very easy. Tell you. Is it tough? No. Is it difficult? नहीं, अरे not at all. Is it tough? This Mool-Chandani-Bhoj-Conlin syndrome is tough? No. Kagami-Ogata syndrome, paternal UPD, is it tough? No, sir. Easiest question on this planet, I guess. Tell yourself, okay? Even though it is not true, but tell yourself, okay? Exactly. So we have Angelman syndrome, of course. We all know that. Can you please have quick answers on this one? Angelman syndrome, can we have 5 important points for this syndrome? I am a NEET PG student and FMG. I don't remember it at all. Yes. Dr. Yogi says, sir, when will be the session for FMG? This session, bro, dear, it's for FMG and for NEET PG both. Nowadays, it is no, biased thing that FMG will have light questions and PG will have heavy questions. Finish it off, whatever comes on the way. That's all I can say you, frankly speaking. Hanji. Okay, yeah. So again, very important, in the Angelman syndrome, basically, there was a micro puppet show. See, angel is the mother, right? Mother. Angelman syndrome, maternal gene is deleted. Angel is the mother and maternal gene is deleted. A very quick mnemonic. There was a micro puppet show which got delayed by 15 minutes. Make mother hyperactive. Very nice, simple mnemonic. It was a micro puppet show. Okay, why micro? Micro means microcephaly. Puppet, they are the happy puppet faces. Micro puppet show which got delayed matlab developmental delay, bro, and delayed by 15 minutes. By 15 minutes, chromosomal 15 is involved. You remember, right? Chromosomal 15 यहाँ पढ़ा था हमने, yes or no? ये लिखा है यहाँ पे. Micro puppet show was delayed by 15 minutes. Okay, the micro puppet show was delayed by 15 minutes, which makes the mother matlab maternal gene is deleted, makes the mother hyperactive. And how are the childs? They are hyperactive, happy puppets, hyperactive. गया मैं. So these all are the, क्या बोलते हैं उसको, pointers for the angel man syndrome. ठीक है, समझ में आ गया. चलो, संभव अवस्थी, संभव अच्छा नाम है, मैं अपने बेटे का नाम रखूंगा संभव. संभव, भ भी आ रहा है इसमें. नाइस नेम, संभव, वेरी नाइस नेम, संभव. So I would like to thank Dr. Nayan, one of my dear juniors from Nasik. He only told me this mnemonic. So thank you, Dr. Nayan. Someday you will watch my videos and you will say, Dr. Anand ने मेरा नाम कैसे ले लिया? So it's thank you, Dr. Nayan. Yeah. So maternal gene is deleted and paternal gene is doubled in angel man. Angel is the mother. Maternal gene is deleted. So naturally paternal gene is doubled. That is why it is known as uniparental. Uniparental disomy. ठीक है, please what do you call, don't forget it. Connect, keep it light, keep your brain very light. The class is ending now, it's already over 1 hour, and that's it. The patient will have developmental delay, the patient will have intellectual disability. ठीक है, and बस काफी इतना. हाँ, so very importantly, happy puppet, right? Spontaneous laughter, the patient are happy puppets, right? Now triple star mark, which gene is deleted? Chromosome 15 तो हो गया. The micro puppet show was delayed by 15 minutes. No, make the mother very hyperactive. Very crazy gene, UBE3A. We have done all the genes. I will not be here. I will not tell you. I will not be here. I will not repeat those genes. Yesterday classes we have done. अगले हफ्ते repeat करूँगा सारे genes. But अभी UBE3A gene, UBE3A, UBCT. Have you been to Bangalore? Bangalore UBCT is very posh area. So UBE3A gene deletion on chromosome 15. Done. Yes, exactly. What is this Willy? Which Willy? Is this Prader-Willi? Is this Angelman? What? Of course, it is a Prader-Willi syndrome. Can we quickly have some 3-4 points by looking at this picture? Can I write obesity? Yes or no? Can I write this one? They eat a lot? Yes or no? Can I say micro penis? They can have micro penis. So all these are very important points. The baby will be obese. He will eat a lot and micro penis. Right? 3 तो यहीं पर ही हो गए. Prader-Willi, and you know that Prader paternal gene is deleted and maternal gene is doubled. वो भी point हो गया. It's a good. So again, very importantly, again Dr. Nayan from Nasik. Thank you for this one. So father वाला पढ़ रहे हैं ना, Prader-Willi paternal gene. The mnemonic is father वाली मोटी girlfriend. ठीक है, कहाँ चला गया? 1 second. Yeah. So father वाली मोटी girlfriend sounds. This is the mnemonic Dr. Nayan could make. फादर वाली मतलब प्राडर वाली. यस और नो? फादर वाली, प्राडर वाली, राइट? मोटी गर्लफ्रेंड. M for microcephaly, O for obesity, and moti, I, increase appetite and intellectual disability. Very beautiful, very quick points, है ना? मदर करो, फादर वाली मोटी गर्लफ्रेंड. मोटी मतलब obese, right? The child will be obese, right? Yeah, exactly. So the pointers are father wali means Prader-Willi, moti, M for microcephaly, obesity, increased appetite and intellectual disability. Father wali moti girlfriend. Remember that, okay? Yeah. And what is the other name for this syndrome? I think you might not be knowing. This is known as refrigerator lock syndrome. This very importantly, for this I would like to thank Dr. Nitin, one of my very dear JRs from South and extremely intellectual, very smart, brainy fellow. And so he told me, what is the other name of Prader-Willi? I was like, it is not even there in Nelson. He's like, It's easy, bro. This is refrigerator lock syndrome. I was like, okay, thank you. That's what. So done. These points are over. So what else? What else? Yeah. What can you see here? Can you see very beautiful picture? Very beautiful. क्या लग रहा है यहाँ पे? Exactly. What is संभव? ऐसे क्यों कर रहे हो? क्या हुआ? ठीक है. So what is this? Single palmar crease. Single palmar crease. Okay. Single palmar crease. Done. Perfect. That's what. So very importantly, we must know this one. What you called? Yes, the patient basically. Can you see this very importantly? Chromosomal analysis you have, and क्या लिखा है? Micro deletion 15q 11 13 deletion for Prader-Willi by fish. Fluorescent in situ hybridization. क्या हुआ? आगे 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 ये तो 9:25 हुआ है. ठीक है, डन. सो दिस पार्ट इज डन. फिश इन्वेस्टिगेशन शोइंग माइक्रो डिलीशन ओवर हियर 15 जीन डिलीशन. ठीक है, डन. ओवर. Perfect. I think let's finish this class. That finishes the class. The paternal gene is missing or affected. Maternal gene is doubled. Obesity I saw, small genitalia I saw, chronically eating I saw, and that's it. Then we have from Nelson, this is like consensus diagnostic criteria for Prader-Willi. We have major and minor, not that like for super, these are for USMLE and super specialty. Then we have proper consensual diagnostic criteria for Prader-Willi. Then we have nutritional phases in Prader-Willi, and this and that. That's it. That finishes today's class. Very importantly, yes. So very beautifully Saloni said they eat a lot, so refrigerator is locked by father. Very beautiful. Thank you, Saloni. Very beautifully Saloni has told the how will I remember that the Prader-Willi syndrome is also known as refrigerator lock syndrome. So very beautifully she said because they eat a lot, na, so refrigerator is locked by the father. Thank you so much, Dr. Saloni. That finishes today's class. Did you like this class? ये हम बाकी questions बाद में करेंगे. Okay, that finishes today's class. Okay, that finishes today's class. I will बहुत सारे questions हैं, but आज के लिए इतना ही क्योंकि it's 1 hour class. I always tell my students to have a quick. Tomorrow we will finish other amazing questions. So did you like the class? Yes or yes. Put the last like thumbs up button on the video, or you can put in the comment section also. Yeah, thank you so much everyone for this wonderful participation. I hope you had a great time. I had a lovely time. I hope I was able to make you feel comfortable, not stressful, but try to have a light session. Okay, that finishes the super hit session, and tonight we have a class at 11 p.m. on the Unacademy app. If you're free, come to the Unacademy app. We have a 11 p.m. class today. Some crazy nice top important images in pediatrics. I'll show you the image to tell the diagnosis. It's as simple as that. So before leaving, we always thank you Osama, thank you so much Osama, and thank you so much everyone for this wonderful participation. इसका PDF मिलेगा. हाँ मिलेगा ना, सपनों में मिलेगा. सपनों में, सपने देखिए हैं, सपने देखते हो रात को, सपनों में PDF मिलेगा इसका, रियल में नहीं मिलने वाला. ठीक है, हाँ जी. हलवा, हाँ खाऊंगा, थोड़ा सा, हाँ खाऊंगा. ठीक है. बिफोर लिविंग वी हैव दिस मोटिवेटिंग कोट. टुडेज ब्यूटीफुल मोटिवेटिंग कोट इज यू कांट पोर फ्रॉम एन एम्प्टी कप. You can't pour from an empty cup. Okay, you can't pour from an empty cup, bro. So the most important point is you have to be positive in life. If you are negative, you can't make others positive. If you are sad, if you are half-hearted, you can't put your best output. So please, for heaven's sake, my sincere request to every single person on this planet, please be positive. Be positive. Tell yourself you are a beautiful soul. Tell yourself you are a beautiful soul. Tell yourself you are a happy soul. Tell yourself you are a peaceful soul. See, whatever you feed your mind, frankly telling you, bro, I read a lot of motivating quotes, novels and stories, and I follow Osho and BK Shivani, Brahm Kumari Shivani, many amazing people. They always say, like, tell your, whatever you train your mind, that will happen. Will you clear this exam? If you say, I think so, I will try and all that. So how the marks will come? Think so and try. Okay. So will you clear this exam? Yes, I will clear. Do you have that courage? Oh my God, what are you saying? Yes, I have that courage. Do you think you can do it? Of course, sir. What are you saying, sir? I was born to rock, sir. It's as simple as that. No one can finish 100% syllabus. Frankly speaking, it's never about finishing 100% syllabus, bro. It is all about revising the high yield content, revising the most important parts, revising the last 3 to 5 year question papers of AIMS, NIMANS, JIPMER, FMG, INICT, UPSC, and NEET PG. Don't think if you're a FMG student that this is a light one, FMG में तो light questions आते हैं. No, there's nothing like that. Don't dream, okay? This is real life. This is not a dream, it's real. So you can't pour from an empty cup. You can't pour from an empty cup. So if you are empty, you can't give empty result. You will give empty results. You can't give a beautiful result, right? So tell yourself, number one, I am a positive soul. Number two, I am a beautiful soul. Number three, I am a happy soul. And number four, I am a peaceful soul. Tell yourself, once you say I am peaceful, trust me, you will become peaceful. Okay, it's all what you feed inside. I am angry, you'll become angry. Okay, no use of being angry. थक गया मैं. ठीक है, चलो. आरपी नोट्स बनाओ, इसके नोट्स बनाओ, नोट्स बनाइए मैडम, नोट्स बनाइए इसके. ठीक है. थैंक यू सो मच एवरीवन फॉर दिस वंडरफुल पार्टिसिपेशन. हाँ, माय भाभी इज मेकिंग हलवा एंड आजा ओसामा, आजा साथ खाते हैं. ठीक है, थैंक यू. चलो जाओ जाओ, चलो गो 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 go went gone go. See you tonight at 11 p.m. with another crazy amazing class with some amazing beautiful questions. Thank you so much for this participation, and remember, आओगे तो welcome, जाओगे तो भीड़ कम.